Hello, everybody. Welcome to the edition this week of Advocate Health Advisors, the AHA podcast. Welcome.
Hello.
Hello.
So, lots of exciting things happening these days. I have some really exciting carrier meetings and some executive meetings. I'm going to get to meet RFK tomorrow, so I'm excited about that. But I want to be tactical and practical today. So we have 5 things that you need to think about and do to be ready for this AEP. And a lot of it, I think, is stuff you would know. We've tried to put it in an order for you that will be helpful. And the first, I think, is just Alyssa, make sure you're prepared, is what we came up with for number one. And what does that mean? What does a broker need to do to make sure they are prepared?
There's a few things. Number one is obviously make sure that you are getting certified or recertified with the carriers that you're either currently contracted with or maybe in the process of getting contracted with. Because if you have a lot of carriers under your belt, you might lose track of the status with each one. You might lose track if you're ready to sell. So we advise take it carrier by carrier and go through and check your status with those carriers. And then on a bigger, broader level, you want to check your licensing. Make sure that your resident state license is current. And if you have non resident states, you want to make sure those licenses are still current and aren't expiring right in the middle of AEP. If your birthday is October, November, December, I don't know how it works in every state, but I know in Florida, your license, you need to do your CEs every 2 years and they expire at the end of your birth month. So definitely want to make sure that your licenses are current, your CEs are up to date, that there's nothing that you have to do there when it is in the middle of AEP, and that you're ready to sell and have your certs done for all the carriers.
Thanks,
Yeah,
Alyssa.
one thing I like, I
Yeah.
was going to add to Alyssa, one thing I like is when I take my AHIP every year, I get CE credits when I take the
Mhm.
AHIP. So, I just encourage everyone that does AHIP to pay that little bit of extra money. It's like, I think for me, it was like $25 and I got 6 extra credits of CE credit. So that way, when I have to redo my CE every 2 years, it doesn't take me as long.
Or NABIP includes it too. NABIP, the certification there is $99 and it includes state CEs. So either one is a
Yeah,
good resource for
that's right.
CEs.
Is there a logic for one versus another with NABIP versus AHIP? Because I
Re-
support them both.
Well, it really just depends on the carriers and who they accept. AHIP has been around a long time. NABIP is a bit newer, although it's been around for a few years. And I think each year we see more and more carriers accept NABIP in addition to AHIP. Some accept both, some accept only one. So usually it's whatever carriers you work with will dictate like which one you're going to take.
Yep. That's the main thing. So thank you, Alyssa. What I was going to say there too was that it's surprising how much the pace quickens from here, right? It only gets faster. And then, and I love a procrastinator because I
Mhm.
too am good under pressure, as my aunt used to say. But the fact of the matter is it only gets quicker. And so if you keep putting off anything at this point, you just have to bite the bullet. And then those curveballs come and get you, right? So I've got an October birthday. This isn't my year, but I remember last year I was like, oh, geez, and I had totally, should have had it on my CRM or my calendar, but I didn't. Thanks to you actually for reminding me. And then I was able to go out and get it done. So number two on the list, though, not to be confused, is after you are prepared and you make sure that you're prepared, as we discussed, you got to make sure your book of business is prepared, right? You got to prepare your book. And so, Jacqueline, what are some of the tips and tricks for preparing the book, and how do you do that review? And we're a knocks farther, so don't get down to number four. Stay within preparing your book. What can you do now, given that it's not October 1st or 15th? What kind of things can you and Alyssa, keep us compliant? But Jacqueline, what can we do now to prepare the book?
Yeah, so one of the things a lot of agents are doing now is just reviewing their book of business details by plan type. So just taking stock of, how many carriers your clients are across, and maybe by product type too, where most of them reside by county. So most agents, know this, but agents with big bucks, it's an important time of year to take a look at that. And so as you're out there and hearing any, carrier news from any rollout events or anything, that you can keep that in the back of your mind about your strategy for client communication after October 1st, of course.
Yes.
Well, but I mean, let's be clear. If they're your existing client, because health plans change, right,
Mhm.
county by year, but people's situation changes, and there's no reason that you can't call your client to check in, update your information, right? If they plan on moving, if they've had a life change, if they've had a health change, right? So it's perfectly fine to keep that. In fact, you should be talking to your clients every month or so, birthdays, holidays, just whatever your schedule is for check-ins. Obviously, we'll talk about technology in a minute. We've got some tools to help you with that, and there's others out there. But I think people sometimes put it all together. But looking at the book of business and checking in with the book of business, I think is a prime time to do that. And Jennifer, speaking of that, because we don't know a lot of information, we do know some though. We know we're expecting a bumpy ride, exciting roller coaster. You better like roller coasters if you're in the Medicare Advantage business. So, what about carrier meetings? I think number 3 was attend the carrier meetings and rollouts. Jen? You got any thoughts on that? You've
For
been to a
sure.
couple of those.
Yeah. I mean, so we always get updates from like a national level, right? And we try to like put that out there to the all of our partners that we work with. But then also the carriers are holding individual meetings in your markets on exactly what's happening in your particular state or county. So I always encourage agents to attend those. They can connect and get a little bit more, detail. If you're living in, just generally speaking, if you're living in the Midwest or the Northeast, things are like, always a little bit crazy. So I have a special place there for the agents trying to work in those markets to figure out what the strategy is going to be. We have a new, I would say, thing that's coming into play around what's going to be commissionable too. So it becomes part of the strategy. And then also when you're, finding out from the carriers, it's also being aware of what's going on with the different provider groups, right? Which provider groups are going to take which carrier. So just being able to sort of analyze all that, making that part of your sort of personalized marketing plan, either for your current book or how you might be going after new members. I think that it's really key right now to be in touch with those broker managers.
Right. Yeah. Lots of knowledge there, and it's a little more refined, right? So, like you said, Jennifer, we get general stuff. Poor United, they had stuff they wanted to share, and the day before the meeting, they had a rebid. They had there's changes. And last year, we saw Humana came late to the market with an awesome change, but it was literally, last minute. So
Mhm.
we're going to be, flexible, right? Always flexible. My Marine friends say, "Semper Gumby," always flexible. So, but Jennifer, you kind of put a little peek in the box there. So we'll get to PMPs, but let's talk about ANOC. So, Jacqueline, what does ANOC stand for? What do we do? And how is ANOC different than just talking to your book of business like we talked about as the number 2 item?
Yeah, so the annual notice of change, otherwise abbreviated ANOC, is an important communication that Medicare Advantage and Part D plan members receive from their health plan every fall. A lot of agents always ask me when do my members usually get this communication, and big wave comes in the 3rd to 4th week of September typically, and it reviews the changes and costs for your plan for the next year, assuming it's going to renewal. There's also another part of that communication that could happen, which is a non-renewal notice if your plan is not renewing for next year and there's going to be a market exit. Instead of the traditional ANOC, your plan will notify that to you, usually by October 2nd through that communication as well. So it's an important document. It can vary between 10 to 30 pages in length. I, recommend to definitely review it. It has changes to any premiums, cost sharing, formulary tier cost sharing as well. And a lot of agents, can see the official document usually on October 1st, and they help review that with their members too.
Wait, it comes out, but you can't see it? Help me understand that
It's
again. Because
usually
notice the
published.
change.
Yeah, it's usually published by the health plan sites by October 1st. So you can go in there and download the PDFs and you can read what your members received. And it's a good reference point too. So you can help your clients review that information, address any, important
So the
contacts.
brokers can see it on the 1st.
Yes.
But the
And one
clients might get it in September before October 1st.
Yes. So they might most beneficiaries get it in the mail unless they opt in for electronic communication. So that's just important. Not just from my experience of speaking with agents, not everybody reads their ANOCs
What? Come
summary.
on. How many
No,
pages is it?
It can be up to 30 usually pages, depending on the plan type. And so it's just,
30 health insurance detail related pages. Who wouldn't devour that first thing in the morning?
yeah, some of the charts in there are definitely helpful in there as well. And then it will go over to like changes to if there's any tier cost changes and copays or anything. It won't, include the drug formulary. So you really have to know what drugs you're taking and what tier they're going to fall under next year. So that's really important to have that conversation with your broker because those are not included in the ANOC.
So can they call their broker when they get the letter if they
Absolutely.
have questions?
Absolutely, and we're actually a lot of brokers right now are getting ahead of ANOC. So right
What?
now, yes. So right now we have a campaign that Advocate helps our agents with, the annual notice of change communications letter that they send out. And they're right now we're working with agents so that these letters deliver to these households around the same time, if not a little bit before the ANOC period. So that way they're aware of what that communication means for them and that they reach out to their agent as their first point of contact so that if they have any questions, they know who to go
Now,
to.
are you competing? Are you trying to make like a 60-page document to let them know that there's a 40-page document coming or
No, this is a one page, for many cases,
what?
a
One
one-page
page?
letter from their agent letting them know, hey, this is what annual notice of change means. This is when the Medicare annual enrollment period is. Call me. I'm happy to explain it. And there's even a checklist on some of our letters too, explaining not only that plans can change every year, but their healthcare needs can change, the medications they're taking and the doctors
Did you use
they're
AI?
taking.
Did you use AI to
No,
make that
we
letter?
have a great catalog of pieces we actually built with agents over the last few years, and every year we just refine them. I think this year's catalog, we have at least over 10 letters because it's not only the ANOC, you can include a lot of things in there, like if you're having a seminar or educational event too. So you can be really proactive and
Human
making,
intelligence?
yes, human
So
intelligence.
seminar. Oh, well, that's a good one. You know what? That's not going to conflict with number five because I don't want to sneak into number five when we're still in number four. Talk about seminars, and that's probably part of being prepared and making sure that you and your book of business are ready. How would that work if you wanted to do a seminar?
Yes, what I'm seeing too is they're having seminars specifically for their book of business and clients. And sometimes they're even breaking it out by carrier to go over, those specific changes coming to those plans because understanding those changes is a conversation. And if you're an agent, especially with a bigger book of business, you sort of want to streamline, your communications with your clients and helping them understand what that means for them and then, of course, during AEP, they can help review any changes that they might want to make to their plan as well. But it's a great retention effort. A lot of clients do turn out to those events, and they're pretty popular. So agents are scheduling those out right now. Most agents that I've spoken with have already picked their places that they're having those, are getting their RSVPs in there with their ANOC letter. And a good trick too there is on our ANOC letters that agents are using, they're also using it as an opportunity to collect the scope of appointment. So we have a contact form on Advocate for Agents. You can turn into it's electronic scope of appointment form that you can turn into a QR code. So there's a lot of proactive steps that agents are taking right now.
Yeah, well, good. That sounds very official. You sound very official, Jacqueline. Thank you. I would say too, not everybody likes to be in front of their book. I remember in the old days, I'd get together with agents and I'd be like, "Hey, let's get your book together." Like, no way, my book's like 300 people. I'm
Mhm.
like, "Yeah, but and they're like, "Yeah, but I know them one at a time. I don't want to be in front of 350 people." So to each his own. I like that, but you got a lot of good things in there in the ANOC. There's a lot of good material. And then, if you do, we're going to move on to number five, which I think we kind of bundled as, support and technology. And in that, Jennifer, you hit on the personalized marketing plan. So if you do have bandwidth to go out and, you know, do more than just take care of your current book and the referrals, because, they're going to have lots of people that need lots of help too. So it'll be a record year for plan changes, a record year for referrals. But we do have a personalized marketing plan, and then we have some support and some technology. So Jennifer, why don't you talk a little bit about the marketing plan and the support, but mostly the technology. And then, listen, maybe you can ping on the support as well. Go ahead, Jen, take it away.
For sure. Yeah. Thank you. Well, it's an exciting time of the year. It's a great time to kind of think about how you're going to improve your book of business. But what if you don't already have one, right? Or maybe you only have a few members? The first thing I'll
You'll
say
have one
is
at the end of this AEP, that's for
yes,
sure.
you
Yeah.
will at the end. I mean, disruption is opportunity. My heart goes out to our agents with the big, large books of business that had to do a lot of changes last year or the year before, and then now they're having to do changes again. So, we like to be the place for you to come talk to and give guidance and just cry on our shoulders together, because we understand. And I love all the different technology you have in place and options to just make their lives easier, right? We don't want any agent to feel like they're alone out there. Okay. I love when I think about technology, when I think about AI, when I think about all the different items available out there for our industry, think of it like a buffet, At Advocate, we have a buffet of items and tools, and you can come and pick what you want off the buffet. So we don't require that you have to use a particular CRM, a particular enrollment platform, a particular, AI service. We make a lot of those different things available, right? And you can decide which one you want to use that works for your system and the way that you want to do business. Personalized marketing plan is great. We have an awesome resource, and I'll just touch on it a little bit. It sort of helps you like map it out. You know how they tell you if you write something down, you're more likely to do it,
Mhm.
right? So a
Yeah.
A
commu-
short pencil is
yeah,
better than a long memory.
Yeah.
yeah, exactly. So, a personalized marketing plan can literally be a notebook where you just start taking some notes, right? As you go to these carrier meetings, you get a little nuggets of information, right?
But what else
Maybe
could it be? Because we have more than that. Come
yeah,
on.
we do also have a place on our website. And what I love about the place on the website where you can say, my goal is to make 100 sales, and then how many people am I going to talk to? Where am I going to go to get those connections in my community. I love the part in there about all the different, you call it 80 different places in the community that you can reach out to. There's some nuggets in there. We've got
That
all
you
these
can
different
compliantly market
that
Medicare
you can
Mhm.
Advantage.
comply it really market, correct. Alyssa will keep us straight. But it just full of ideas out there about where you can go and then just where to reach out. And the idea and the success of being successful isn't just to have one big idea, it's to have a lot of ideas, right? Wasn't it Rockefeller that said that? So if you have lots of
I
ideas,
said it.
you said that too. Yeah. If you have lots of ideas, then, some of those are going to be successful ideas. So you really have to get yourself out there in front of a lot of different places. Maybe that's a FQHC or food pantry. Maybe that is, working with a local community center in your area. Maybe you have a great relationship with your church. Maybe you have a partnership with a local community bank. Maybe you have a connection with a financial planner that doesn't do Medicare, right? Maybe it's a PNC office. So it's just really getting out there. And we have marketing pieces for all of that. It's available to help you. So to me, that's
Well,
what a personalized.
Jennifer,
Yeah, go ahead.
that's really helpful. I want to interject there and just say that all those people in all those places need help making these important, complicated, and meaningful decisions. And they all have a gatekeeper, right? There's always a pastor of the church. There's always someone at the food pantry as an administrator or the housing authority or the office of the aging. There's people that are tending to their flock. And I don't just mean that in a, congregation sort of a church way. I'm just saying that, if you're in and of your local community, you've earned the credibility, you've got the, reputation of quality that you've built over all those years, they're going to see it as a value that you come in with your knowledge and expertise and professionalism. But Jennifer, one thing I got to say, I'm going to have to call you out a little bit and see if Jacqueline can help us because you're agnostic on the different technologies and the cafeteria style. But I know people on the technology team that have been talking to hundreds and hundreds of agents a month over years, and they've built custom advocate technology. And so when I see other people out there saying, we've got the best things in sliced bread, it's like snake oil in a bottle. Like, I just think that we should let Jacqueline talk for a minute about the technology that's out there that's been built basically directly from the requests of agents and seeing shortcomings in some of that other stuff available. Isn't that right, Jacqueline? CRM and otherwise?
Absolutely. We have a lot of tools on Advocate for Agents. So if you're an Advocate agent and you haven't gotten started, please register. We'll include the link. And it's also available as an app on Android and smartphone. And a few of the common ones, Darwin just mentioned. We have a CRM tool where, we actually update it for you. I think a pain point for agents that we heard was they were going out buying expensive CRM tools and then felt the burden of having to always keep it up to date. So we took that pain out for agents. And so we push through data that we get from our production reports across our book of business reports, and we feed it at least a couple times a month for our agents, and they can actually see that in there. They can also track.
Not only up to date, I'm sorry to interrupt you, but
Mhm.
you're so smart, I can't follow it after 10 seconds. So it's not only up to date. We had people that bought a CRM tool from somebody else, even though we had one that you all built, and they never put their data in it because they were so busy, and they bought the CRM tool in hopes of being less busy. But it was actually more work after they bought it to load it, so they never use
Yes.
it and they paid all that money. Whereas what you're saying is in some cases, we can even pre-populate it and it's a low or no additional charge.
Yeah, absolutely, and that's the awesome part of the CRM tool too, and you can upload, of course, clients to it as well as you need. The cool thing too about our tools is that, we have some newly developed ones, including Advo Center, where it even has some cool automations in there. You have a calendar if you want to schedule appointments. You can generate your own QR codes. You can bring in your social media on there. So we have more technology sometimes than we can actually talk about. So I think that's just an opportunity, for agents to go out there and look at that. The newest, I think, feature too, especially on our production report, because we take all the carriers across different kind of reporting, RTS, a ready to sell, production, book of business, and we feed it for agents in this portal as long as they're ready to sell with us and they're registered for Advocate for Agents. And the cool thing there is we're actually providing data on when we see an application. We call it CRE. So that means it's approved by the health plan and it shows on the book of business. And we've also included any rapid disenrollment information in there. So agents have better access to their book of business data and actually what's happening with their production now more than ever across all the carriers that they write with. So it's very helpful. So I recommend going in there and looking at that.
Yeah, it's good stuff. Jennifer, you lit up. Were you going to say something? And before you do, Jacqueline, is a smartphone the same thing as an iPhone?
Well, I guess
Because you didn't say
Android.
iPhone. You said
Well,
Galaxy first. And of course, like,
did I say
I don't know what
Galaxy?
you
It's
said
a type.
something.
It's a
I don't
type
know
of
what you
smartphone.
said. They're
I
all
think you're supposed
smartphones,
to say
right?
Android.
Android. Yeah.
She
iPhone or
did say
Android.
Android. That was
Yeah.
I was like, oh, I
mistake.
haven't heard
No,
Galaxy in.
but you gotta say smartphone or Apple, right? Doesn't Apple iPhone
No,
have like a
smartphone means Android
who's
or
got a
Apple.
bigger percentage of the market? Because she said Android first, and that threw me off because I'm an Apple guy.
Yeah, most.
Probably Apple, right? Has a bigger
Who's got the
share, but
most? Come on, we'll do stock picking
We'll
later.
chat GPT that.
Well, most of our agents that I know have iPhones, and then so we rolled the app out on iPhone, and
There you
then
go.
and then
That's what I was looking for.
yes, and then we also added Android secondary. So we met the demand of iPhone first, and now it's also available on
Yeah.
Android.
That's what I was on. All right. And then Alyssa, real quick on any additional support you want to talk about, agent care team, and then we'll do round robin and wrap it up.
yeah. So Jacqueline did a great overview of the technology that we have out there for agents to use. And I like how Jen said it's a buffet. It's not all packaged in one thing where it's all or nothing. It's like use what works for you. And when you were talking about the CRM tool, I remember agent back before we had created our CRM, an agent had gone and utilized a third party. She paid for a subscription to a CRM, a pretty popular one too. And it was so confusing for her that she actually called us and we stayed on the phone with her for like a whole afternoon, loading her book of business into this third party CRM platform because it was so confusing for her that we had to help her like get her book of business in there. So we have a much easier, much more user friendly one. And when it comes to support and like obviously for AEP, when we talk about planning events and stuff like that, you want to make sure that you're getting those scheduled out in enough time. If it's a sales and marketing event, that you're getting it reported to the carriers in time. I mean, 14-day minimum is the minimum, right? You want more than that if you can. but at least 14 days you want to be reporting it to the carriers that you're going to be representing. So that's really important. And then when it comes to advertising your events, there's a lot of ins and outs when it comes to that, disclaimers that need to be on it depending on the type. So we have a compliance email box where our agents can email that. It's compliance@advocatehealthllc.com, where we review materials for agents every day. We're doing a lot of them every single day, so we can review what you're putting out there.
All right. Well, thank you. Let's do closing comments. Jen, why don't you start us off?
Well, closing comments is coming into the 22nd AEP that I've been in. It's so
Yikes.
exciting. I mean, nothing surprises me anymore, but what I love is that there's always an opportunity to help seniors, and we need more agents, honestly. You think about how big the Medicare population is growing and it's exponential and it's continuing to grow. Those beneficiaries need help and they need someone that they trust in their community. Agents are starting to retire. So I always say that why should you be selling Medicare or Medicare Advantage type products? It's because number one, guaranteed issue on the Medicare Advantage, lifetime residual, and an exponential growth of people that are aging in and that need help. And not only do the people age in, but you have the existing people that need to make a decision this year. Some of them don't even know who their agent is. There's call centers that are like really not into it anymore, and they might have been enrolled by that member. Agents can be out in their community and meet people, work their referrals, and they can grow a book of business and do really well by helping seniors get out there, make it happen. I'm excited.
Awesome.
Yeah, I was just going to say, Jennifer, you reminded me when you said, kind of protecting your book of business too. And that's a great reminder this time of year, for the clients, for beneficiaries. So even in the ANOC letter, even when you're talking, with your client, forewarning them, and how to protect their information, because unfortunately, that's just becoming, more prominent. A lot of scam callers are out there too. So just reminding clients how to protect their information and themselves from unsolicited behavior too. So those are all proactive tips that are actually in the letter, and then agents should start telling their clients too.
Yeah, we should talk about fraud next week. Thanks, Jacqueline. Go ahead, Alyssa.
Yeah, I echo, what Jennifer and Jacqueline both said, and there is going to be a lot of disruption this year. And some of the carriers do have agent of record protection pledges, where as long as you're certified for that carrier, if a member switches like plan to plan, the AOR would be protected. But if you have any questions on that, you can definitely reach out to us. And we have a training for the CMS compliance updates where we do a deep dive into like holding the events, do's and don'ts, call recording, scope of appointment, marketing stuff. And it's out there on our Advocate Health University portal. And I would just, even if you've been doing this for a long time, it's always good to just stay refreshed on the rules and kind of the guidelines. So I would encourage everybody to go out there and watch it. Just a little plug for that.
All right. Sounds good. Yeah, we've got a lot of great content. And, I think we probably should spend more time promoting all the great tools we built. We're so humble. We build it and we listen to what folks need and we run off and build the next thing. And I see a lot of people that built one thing, laid off the developers, and they're still selling the same thing that they built 3 years, 4 or 5 years ago. But I want to go back to what you said. And again, like you said, Alyssa, I agree with everybody. But Jennifer, you talked about the agent's view in terms of the guaranteed issue and the renewals, but I want to look at the client's focal point, right? So those renewals are because the post-enrollment services that you provide are so important. And coordinated care is just better than uncoordinated care, right? Medicare Advantage has taken market share because people like it. It's lower out of pocket for them, it's better care, and it's less risk on the downside than original Medicare. And so, it's superior in many, many ways. And I think that people forget about that. But even more importantly, is that beneficiaries, medical errors are the number three cause of death in the US after heart attacks and cancer. And it isn't like the doctor accidentally cut the wrong thing, chopped your head off by accident, right? This is like a missed opportunity for prevention. It's an administrative error. It's a coordinated error. These are things that Medicare Advantage really gets after. Dr. Ross says that 1 in 4 emergency room or hospital visits, not ER, 1 in 4 hospital visits ends in some sort of harm. And that harm is the worst kind of care because you have to, not only did you do something hurtful, you got to go fix it, right? So it's hurtful and it costs more money. And so, in Medicare Advantage, we guide people towards quality, right? We guide the beneficiary to the 5-star plan, to the higher rated doctor, to the higher rated hospital. And it's their choice, but we can help them be informed and we can help them navigate 30 and even in some cases 300-page documents or unlock values that have sequential hurdles that you have to get through. They're not trying to hold back the benefits. They're just trying to judiciously allocate them. So unlocking those benefits. That's what we do. And then from the industry perspective, as if saving lives wasn't good enough, the things that we do as a community, brokers and FMOs together, there's nobody that does it better, right? And it's absolutely necessary. If they eliminated all the folks that do what we do, then someone else would just have to do that, which is why we have this shared infrastructure. So it definitely needs to be done. It's incredibly valued to the beneficiary. It's a safety net, and we do it at a fraction of the cost because it's a shared infrastructure. And so that makes this business great, and it's a terrific value. It's great that you can make a living doing it, and it's not often in life you can do good for others and do well for yourself in the process. So with that, we're just a little bit over 30 minutes, but it was worth it, hopefully. And if anybody is old enough to remember genuine leather instead of artificial leather, send me a little like or a post on social, because back in the day, imitation leather was bad, genuine leather was good. So I think artificial intelligence versus genuine human intelligence, like we have here at Advocate, I'd like to know what you think on that. So give us a shout, and thank you, everybody. See you next week.
Bye,
Thank you.
everyone.
Bye.